Alopecia is a medical term. It means hair loss. This condition can affect anyone regardless of age, gender, or ethnicity. It is a common issue that many people face at some point in their lives. This can happen on your scalp, where it is most noticeable and often most distressing for individuals. It can also happen all over your body, affecting areas such as your arms, legs, and even eyebrows and eyelashes. Hair loss can be temporary, often caused by factors like stress, illness, or nutritional deficiencies, or it can be permanent, resulting from genetic factors or chronic medical conditions. Sometimes it appears in patches, which can be particularly challenging to manage and conceal. Other times it leads to total baldness. Alopecia is common and can have a significant impact on a person's self-esteem and quality of life. It affects men, women, and children, showing no preference for any particular group. Many things can cause alopecia. Sometimes it's our genes passed down from one generation to the next. As we age, we might lose hair naturally. This is a common part of the aging process. This is the most common cause of hair loss, often seen in both men and women as they grow older. But there are other reasons too. Factors such as hormonal changes, medical treatments, and severe stress can also lead to hair loss. These can include medical conditions like thyroid disorders, autoimmune diseases, and even psychological stress. Understanding alopecia is important for managing it effectively. Knowing the types, causes, and treatments can help people cope better with the condition and seek appropriate medical advice. It can also lead to finding the right solutions, whether through medical treatments, lifestyle changes, or supportive therapies. This essay will look at alopecia in detail, providing a comprehensive overview of the condition. We will examine its types, causes, and ways to manage it, offering insights into both medical and holistic approaches. This information is for everyone, aiming to educate and support those affected by alopecia and their loved ones. There are many types of alopecia, each with its own distinct characteristics and causes. Understanding these differences is crucial for proper diagnosis and treatment. Each type has unique features that set it apart from the others. Recognizing these features can help in identifying the specific type of alopecia one might be experiencing. Alopecia areata, for instance, causes patches of hair loss. These patches can appear suddenly and may vary in size. These patches are typically round or oval in shape, making them quite distinctive. They can appear anywhere on the body, not just the scalp. This includes areas like the arms, legs, and even eyebrows. Androgenetic alopecia is another common type. It's often referred to as male or female pattern baldness. This type of alopecia is characterized by a predictable pattern of hair loss which differs between men and women. It's primarily caused by genetic factors and hormonal changes which affect the hair follicles over time. Telogen effluvium is a type of temporary hair loss. It often results in diffuse thinning rather than distinct bald patches. This condition can occur after significant stress, illness, or as a side effect of certain medications. Anagen effluvium is also a temporary form of hair loss, but it is typically caused by chemotherapy or radiation treatments. These treatments target rapidly dividing cells, which include hair follicles, leading to hair loss. These are just a few examples of the many types of alopecia that exist. Other types of alopecia exist, each with its own set of characteristics and causes. Some types are specific to certain ages or genders, making it important to consider these factors when diagnosing and treating hair loss. For example, postpartum alopecia affects women after childbirth, often leading to noticeable hair thinning. Alopecia areata can also affect children, causing sudden hair loss that can be distressing for both the child and their parents. Each type of alopecia has different causes and treatments, making it essential to get a proper diagnosis. It's important to see a doctor for a diagnosis and to discuss the best treatment options for your specific type of hair loss. The causes of alopecia are varied. Genetics plays a role. Sometimes our genes make us prone to hair loss. This is common in androgenetic alopecia. Our immune system can also be a factor. In alopecia areata, the immune system attacks hair follicles. This causes hair to fall out. Hormonal changes are another culprit. Pregnancy, childbirth, and menopause can all trigger hair loss. Thyroid disorders can also disrupt hormone balance and lead to alopecia. Medical conditions like lupus and diabetes can also contribute to alopecia. Certain medications, like those used in chemotherapy, can cause hair loss as a side effect. Stress is a known trigger for telogen effluvium. Even styling practices like tight braids can lead to traction alopecia. Section 4. Risk factors. Certain factors increase the risk of alopecia. Family history is significant. If your parents or siblings have alopecia, you're more likely to develop it. Age is another factor. Hair loss becomes more common as we get older. This is natural. However, some types of alopecia like alopecia areata can occur at any age. Certain medical conditions increase the risk. Autoimmune diseases, hormonal disorders, and skin conditions can all contribute to alopecia. Lifestyle factors matter too. Poor nutrition, stress, and smoking can all increase the risk of hair loss. It's important to eat a balanced diet, manage stress, and avoid smoking. Section 5. Diagnosis of alopecia. Diagnosing alopecia usually involves a few steps. First, a doctor will ask about your medical history. They'll want to know about any family history of hair loss. They'll also ask about your symptoms and lifestyle. Next, they'll examine your scalp. They'll look at the pattern of hair loss. They'll also check for any redness, scaling, or other abnormalities. In some cases, the doctor may order tests. A scalp biopsy can help identify the type of alopecia. Blood tests can check for underlying medical conditions. Once the doctor has a diagnosis, they can recommend a treatment plan. The treatment will depend on the type of alopecia and its severity. Section 6. Prevention and precautions. Not all types of alopecia are preventable. Some forms are genetic or due to underlying medical conditions that are beyond our control. However, there are several proactive steps you can take to minimize the risk and manage the condition effectively. One of the most important things you can do is to practice gentle hair care. This means avoiding excessive brushing or combing, especially when your hair is wet, as it is more susceptible to breakage. Gentle hair care is key. Use a wide-toothed comb or a brush with soft bristles to minimize damage. Be gentle when detangling your hair to avoid unnecessary stress on the hair follicles. Avoid tight hairstyles that pull on the hair, such as ponytails, braids, or buns. These styles can cause traction alopecia, which is hair loss due to constant pulling and tension on the hair. Use a soft brush and avoid harsh chemicals. Opt for hair care products that are free from sulfates, parabens, and other harmful ingredients. Managing stress is also crucial, as stress can trigger and worsen hair loss. Incorporate stress management techniques into your daily routine to help keep your hair healthy. Practice relaxation techniques like yoga or meditation. These activities can help reduce stress levels and promote overall well-being, which in turn can benefit your hair health. Eating a healthy diet is important. Your hair needs a variety of nutrients to grow and stay healthy. Make sure your diet includes plenty of protein, iron, and vitamins. Make sure you're getting enough protein, iron, and other essential nutrients. Consider taking supplements if you have dietary restrictions or deficiencies. Protect your scalp from the sun. Prolonged sun exposure can damage your hair and scalp, leading to hair loss. Wear a hat when you're outdoors for long periods. This simple step can help protect your scalp from harmful UV rays. If you're concerned about hair loss, talk to your doctor. They can help you identify any underlying medical conditions that may be contributing to your hair loss. Early diagnosis and treatment can make a significant difference in managing hair loss. They can also recommend treatments or lifestyle changes to help manage your condition. From topical treatments to lifestyle adjustments, there are various options available to help you maintain healthy hair. Section 7. Conclusion. Alopecia is a common condition that can affect people of all ages and backgrounds. It's important to remember that alopecia is treatable. Early diagnosis and treatment are essential. If you notice unusual hair loss, don't ignore it. See a dermatologist or other healthcare provider specializing in hair loss. With the right treatment and support, people with alopecia can live full and confident lives.